Okay then, we seem to have a good audience emerging for our seminar. So I hope everyone can hear me and is there. And I'm here to say good morning to you all and welcome to the Nuffield Foundation. I'm Tim Gard, I'm the Chief Executive, and the title of this webinar is Trust in Transition. That is a transition from the pandemic and lockdown to whatever social norms may follow it. We have 3 research presentations this morning on, I think, the topic which increasingly really dominates the debate about the credibility and authority of the British government in handling the pandemic and indeed our recovery from it. And at the heart of all these 3 presentations are questions of public trust, both in government and the application of the law, but also trust in information and different media and how this is affecting our behaviour and indeed our preparedness to comply with the laws that have been introduced to control us during the pandemic. And we'll also get an international comparative perspective today that puts the British public mood in a broader cultural international context. All our 3 speakers have been Nuffield Foundation grant holders at one time, and all have been charting in real time the shifts in public attitudes and behaviour as the pandemic and its implications have unfolded over the past few months, and they'll be looking forward as well. So our 3 speakers today will be in order: Dr. Jo Tomlinson, Senior Lecturer in Public Law at the University of York, whose Nuffield-funded project Law and Compliance during COVID-19 is now offering its first preliminary findings. We also have Professor Rasmus Nielsen, Director of the Reuters Institute for the Study of Journalism at Oxford University, and his project has explored in fortnightly waves how the British public has engaged with and navigated the flow of information and misinformation around coronavirus. And thirdly, we have Dr. Alexandra Freeman, Executive Director of the Winton Centre for Risk and Evidence Communication at Cambridge University, and hers is the international perspective, and her international study on risk perception and associated behaviours has revealed interesting similarities and marked differences across different countries and different cultures. So before I turn first to Jo, a few rules of engagement. Everyone attending are neither audible nor visible, so if you want to ask questions, and please do, use the Q&A function as always, submit them at any time, and if your question is for a specific panelist, do make that clear, and we'll take the questions once all speakers, all 3 of them, have presented. We also have closed captioning in English, and a record of this webinar will be available on the Nuffield Foundation website shortly after we've finished. And each speaker will speak for 10 minutes or so, and we aim to close this hard on noon. So we'll now go to our first speaker, and I suppose as a coda to that, it was Boris Johnson who was quoted as saying he never thought it would be so easy to take away people's liberties and so difficult to persuade them to take them back. And that's an appropriate cue to introduce Jo Tomlinson. Jo's presentation actually now is recorded. Sad news is his Wi-Fi broke down last night, but he heroically went off to York Station, York Railway Station, and managed to send us a recording of it. Unfortunately, his Wi-Fi is still down, and so he won't be here to take questions, but if anyone has any questions for him, let us know and he'll email you the answers. So now let's go to the recording of Jo's presentation.
Hello everybody, I'm delighted to be speaking as part of this panel today. Apologies that I've had to pre-record my remarks. My internet connection has decided to be faulty at a very unfortunate moment. I'm going to be speaking today about a project which I'm leading on law and compliance during COVID-19. It's a project that I'm doing with 2 of my colleagues at the University of York, Simon Halliday and Jed Mears. I've been instructed to keep to strict time, so what I'm going to talk about in the presentation is very much a whistle-stop run, whistle-stop tour through the work that we're doing. So to start briefly by providing some background. It was quite clear that even at the outset of the coronavirus crisis that we were about to start a very extraordinary time for research, for socio-legal research. So we're about to see a huge amount of legal change that was going to be done very quickly. That law was those new rules were going to represent quick and significant changes to everyday life for the general population. And at the same time, compliance with those rules was going to be really important, really high stakes. It was pretty obvious early on that we were going to see significant interference with rights and liberties in the name of protecting public health. So some of this picture is relatively familiar to lawyers, lots of legal change happens all the time, but much of this picture is fairly unusual. So the central question that we were interested in is, why do people obey rules? And that was obviously going to be a question that was engaged with throughout the pandemic, and it's a question we have been debating as a society in recent months in various different ways. So our project, in a very brief outline, has three strands. First, we're building a legal database to capture the full legal response to COVID-19 and the position of the lockdown rules in the wider context, and I'm using that as lockdown as a shorthand for the restrictions that were put on everyday life. A second package of work that we're undertaking are national quantitative surveys. We're undertaking those surveys with YouGov. We are conducting multiple ways where we're asking people about their experience with the rules, their perceptions of the rules, to get a sense of the UK-wide picture. And then a third package of work that we're undertaking is qualitative work. So we're running online focus groups and qualitative and interviews, which we're obviously also conducting online. And we hope that when we draw all of this data together later in this year, that we can build a very detailed picture of law and compliance during the pandemic, and hopefully learn some new things about that general question of why do people obey legal rules. At this point, what I'm able to share is some early thinking based on some of the data that we've been looking at, and some headline statistics based on early survey work. So I want to spend some time introducing our thinking. So this is essentially what we're trying to test for through our data set, but it's based on some of the early data that we have seen. So essentially, in response to that question of why people comply with lockdown rules, we think there are various pathways to compliance. So this way of thinking is built on existing literature. Work by people like Tom Tyler has influenced our thinking here. And essentially, we think there are a variety of different drivers of compliance. So we can break those down into instrumental commitments to compliance, specific moral commitments to compliance, and general legitimacy commitments to the system. So trusting the system, etc. We can also then, in a particular context of COVID-19, disaggregate those drivers further. So various different people might have different drivers for complying with essentially the same rules. But we think the picture is a little more complicated than that. What we're seeing and what we are looking for in our further research is whether we continue to see these pathway inhibitors. So that these effects which, although people do have some drive to comply, things that undermine that pathway to compliance. So, for instance, if somebody views the rules as ineffective, so if the lockdown rules actually don't spread don't stem the spread of infection, then somebody who's driven to comply out of fear of infection is less likely to comply with the rules. So our emerging view is that there are a series of pathway inhibitors. So inefficacy of the rules, other people not complying with the rules, and we've obviously seen certain high-profile cases of that issue. Perceiving the rules that are imposed as unacceptable rights violations. If we perceive the rules to be over-policed or being heavily enforced, or if we think that the rules are being made and the policy behind the rules is being made in a way that's unfair. So these different inhibitors attach, we believe, to different drivers of compliance. So this is what we're trying to analyse through our data. So I'm going to close briefly by offering some early observations from our data. So everything I say here is extremely tentative. So in terms of the legal response to COVID-19, there are a few headlines it's worth drawing attention to. We essentially had one piece of primary legislation. It's a very big piece of primary legislation, but most of the legal rulemaking has been done through statutory instruments, so delegated legislation. Essentially, government-made law in practice. We've seen 97 statutory instruments relating to COVID-19 at the UK level, and we've got more at the devolved level too. Potentially the big legal story of COVID-19 is that much of what's being asked of the public is found in soft law, so policy guidance and messages given out by the government. So this is a really interesting feature of the legal response. Also, that much of what has been asked of the public, many of the rules that have been put in place, have received very little formal scrutiny. Much of it has been, obviously these rules have been debated in the press and by the public, but many of the legal rules have been laid using urgency procedures of various kinds. So in terms of how the public are perceiving the rules, we initially found, and this is data taken from a survey conducted in late April, that most people were confident they knew the rules, but when you asked them about specific rules, they disagreed about what they are allowed to do. There was particular confusion on more complex exceptions to the general rules. So in these examples, we can see that there's quite a lot of disagreements about what is and is not allowed. Most people reported complying with the rules, but a significant minority, 32%, reported having broken a rule in the week prior to the survey, or interestingly, bent a rule. So some people would admit to bending a rule, but not breaking a rule. In terms of drivers of compliance, as I outlined earlier, we think there are multiple important drivers. One of the headline features of our first survey is that people's sense of solidarity was provoked most strongly by their families, but even more so by the NHS. So that sense of need to comply with the law to protect the NHS workers was really quite strong. In terms of how people reconcile their rights or the role of rights with the lockdown, we essentially see people undertaking a proportionality analysis. So most people thought they have certain rights, but that violation of those rights was justified in the circumstances. So what do we hope to learn from this exercise? Well, we hope to develop new ways of thinking about that central question: why do people obey the rules? Why do people obey rules generally? So that can help inform future public health responses. It can help inform public policy more generally, and potentially help us develop our thinking around the contested notion of rights within contemporary society. We have a project website where we'll be posting findings as we go. Thank you very much for your time, and I look forward to speaking more about the project. Thank you.
Well, thanks very much, Joe. I'm sorry you can't be with us. We'll now move on to a slightly different angle. We'll go to the issue of public trust in different media and how that has developed as the pandemic's gone on. And I'm going to turn to Rasmus Nielsen, who's going to present the findings of his research in the waves that he's been doing it fortnightly, I think, since mid-March. So let's now turn to Rasmus.
Thank you very much. Can I just confirm that people can see my screen?
We can see you, Rasmus.
My screen share. Thank you very much. Okay, terrific. So thanks very much for the invitation to be part of this, and of course to the Nuffield Foundation for support for the UK COVID News and Information project that I'm pursuing with Dr. Richard Fletcher, a colleague at the Reuters Institute at the University of Oxford, as well as Dr. Antonis Kalogeropoulos, who's a lecturer at Liverpool University. So I suppose really the background here for our interest is the observation that the COVID pandemic, in addition to being a public health crisis and having social and political ramifications, is also a communications crisis. If people are to understand and respond to a disease, to a pandemic that most of us as individual citizens have no real professional understanding of, and for a long time probably no direct experience of, they need to be able to access and rely on credible and actionable information from sources that they trust. On that basis, people will be better able to think about how they can act to protect themselves, to protect their loved ones, and to protect their communities. They'll also be able, as citizens, to better understand, evaluate, and perhaps comply with and support responses made by governments and other authoritative institutions that normally act in our names collectively. What we know already in terms of some early research we did in March is that, of course, in a crisis like this, people rely on many different sources of information and they access them in many different ways. In most countries we've done research, the most important ones are news organizations, governments, often accessed via different forms of digital platforms like search engines, social media, video sharing sites, and messaging applications. Now, this is a complicated environment in which there is very real risk of misinformation, in particular online, perhaps particularly on social media and messaging applications, where we've seen some very wild rumors and some demonstrably harmful information circulate. But also one in which we can sort of think about what the consequences are at the citizen level, whether people are in fact informed. And what we found in that early work is that in most countries, people who rely on news organizations are significantly more knowledgeable about the disease. There is no consistent pattern in terms of whether people who rely on governments for information are more informed about the disease. That's quite a thought-provoking finding, I would say. And while it's clear that there are very real problems of misinformation on many of the large platforms, we find no consistent pattern either in terms of whether reliance on these platforms influence how informed people are about the disease. So with support from the Nuffield Foundation, we've been keen to try to understand how this communications crisis around COVID is evolving in real time in the UK specifically. The way we do that is that we run a fortnightly panel survey working with YouGov, where we survey a sample that is representative of the UK public, serving the same individuals over time with 2-week intervals, to get a sense of how they navigate the infodemic around the disease, how they think about the different sources they rely on, and how that is associated with different outcomes that we care about, like compliance and more. And what I want to do today is just to highlight a few key findings around the theme of trust. The first is to say that if we compare the UK to other countries, I think we can see a pattern that is sort of predicted, which is an early sort of rallying around the flag, where if people are asked about whether the government in a country is handling the issue of coronavirus very or somewhat well, we see early on, as we see in both France and Germany and the thicker line here, the UK, a sort of rallying around the flag where people are more inclined to say that the government is handling the coronavirus well or somewhat well. And then things start to change over time. So these lines document the changes over time in YouGov's COVID-19 tracker in terms of the percentage of people in these countries who say that the government is handling the crisis very or somewhat well. We see rallying around the flag in Germany and then stability at a high level. We see a brief rallying around the flag in France, and then a quick sort of erosion of that, and then a stable, more modest level of support. And in the UK, a rallying around the flag, and then a pronounced and persistent decline over time in the number of people in the UK who say the government is handling the crisis well. This is an enormous decline, a much bigger decline than the one seen in France, and of course very different from the situation in Germany. So a very distinct development in the UK comparing to other European high-income democracies. If we turn from this question of whether people feel that the government is handling the crisis well to the question of what sources of information they trust as they think about the crisis, what they ought to do, and how to think about the responses offered by politicians and others, this is the pattern that we find. First of all, throughout the 4 waves of the survey we have fielded so far, there's very high, consistent trust in national health organizations. In the case of the UK, of course, the NHS. So virtually everybody, irrespective of creed or color or demographic, say that they trust national health organizations as a source of information about coronavirus. When we turn to the question of whether people trust one another, that is also very stable. So we ask people whether they trust people that they know, friends, family, close colleagues, as a source of information about the disease. And again, the pattern we find is stability, though of course much lower than people's confidence in health authorities. Where things I think get very interesting is when we look at the development for the UK government and for news organizations. Both news organizations and the UK government start with majority support. The majority of the British public in the first wave of our survey in sort of early mid-April say that they consider news organizations and the UK government relatively trustworthy sources of news and information about the coronavirus. And then for both of them, again, persistent pattern of decline in trust over time, a decline that is particularly stark when it comes to the UK government, where we see a 19 percentage point decline in the number of people who rate the UK government a relatively trustworthy source of news and information about coronavirus, which is, in my sort of 10 years of doing research in this area, the most dramatic and accelerated decline of trust in an institution that I have ever seen in just a 6-week period covered by these 4 waves of the survey. There's also a marked decline for news organizations, which were never at the high level of the government in the early stages of the crisis, but also an 11 percentage point decline in the number of people in the UK who say they trust news organizations. And by late May, neither the government nor news organizations are considered a relatively trustworthy source of news and information about coronavirus by a majority of the UK public. So a really stark decline in just 6 weeks. As said, we also know, of course, that people rely on many different sort of ways of accessing information about the crisis. And I think this is the last point that I'd really like to end this presentation on before we move on to Alex's work and then later the discussion, which is the role of large technology companies, where we found in early stages of this work that there is very widespread concern over issues of misinformation on many of these companies' products and services, though at the tail end of the study by now there are more people who say they're concerned about politicians and the government as a source of misinformation than say they're concerned about misinformation from the platforms. But I think it's worth wondering about how people think about the way in which these private for-profit US-based companies shoulder the responsibilities that come with operating some sort of rough, so broadly speaking, infrastructural components of our media environment. We ask a question about that, where we ask people about whether they think different institutions are doing a good job, neither a good job or a bad job of responding to the crisis. The decline for the UK government and news organizations is broadly in line with the declines that we have seen in trust. The pattern for the big technology company is interesting. It's basically stable. It's only a small minority of the UK public who say they feel that these large technology companies are doing a good job responding to the crisis. But when we look at the responses in more details, I think a more interesting pattern emerges, which is that while there's been a big decline in the government, in the number of people who say the government is doing a good job, and a significant decline in the number of people who say they feel news organizations are doing a good job, there's been almost no change for the technology companies over time. And the majority of our respondents in most waves say that they feel these companies are doing neither a good job nor a bad job of responding to the crisis. And when we look at the percentage of people who say that different institutions are doing a bad job, I think that the picture here is quite interesting. 40% of our respondents in the last wave at the end of May say they feel the UK government is doing a bad job responding to the coronavirus crisis. Almost a quarter of the British public say the same about news organizations. Only 18% say the same about the large technology companies. So this is what I've tried to capture in the headline of this, or the title of this slide, which is, I think we have a sort of a situation where there is an element of almost of a difference to what we can think of as an invisible infrastructure for a large part of sort of public discourse around the coronavirus crisis, where my personal view is that these companies play an incredibly important and powerful role, and also therefore should shoulder a lot of responsibilities. But it seems that much of the British public, while keenly aware of the real and perceived limitations of both the government and news organizations, at this stage at least, are largely indifferent to the way in which the large technology companies are shouldering their very important role in this crisis. Thank you.
Rasmus, thanks very much indeed. And just a reminder to you all that for your questions and answers, please keep bringing them in, and we'll come to them at the end of all three presentations. And we'll move now to our final presentation from Alex Freeman at the Winton Centre at Cambridge. And her research has been giving a really quite striking account of the similarities and differences of behaviours and indeed of views of trust to various institutions across the world. So let me now hand to Alex. Alex.
Thank you very much. Yes, so really a lot of what I'm going to say follows on very neatly from what Rasmus has been talking about. We study how people respond to communications, particularly about risk and evidence, scientific evidence. And we've been studying, surveying countries around the world. We did a lot of one-off surveys in countries in around April. But we've been trying to survey in the UK every 3 to 4 weeks, and have done a couple of other countries more than once as well. And so what I'm going to talk about is mainly in the UK, but I'm going to try and put that in some kind of international perspective as well. And one of the things that we really see, which Rasmus has already mentioned, is this change in trust. Now, you don't need to see all the details of these graphs, but the thing that I want to show is that really from March, mid to late March, our first survey, and then going into April, May, June, what we see is this trust bump in the UK, where we ask questions about people's trust relating to official or government information. So it goes up, this kind of rallying around the flag, as Rasmus put it, and then we see this steady decline in trust in official and government information. And that is not true of science and scientists in general. So trust in science and scientists, independent from government, has dropped off slightly and steadily, but not seen this up and then more dramatic decline. So I think that's a really interesting finding. For the WHO, it's been a more dramatic falling off since March, and trust in the WHO is an interesting thing that I'll come back to potentially later. One thing that goes along with this that I'm really interested in is people's behaviour and their sentiments about behaviour, because we asked people to what extent they thought it was important to do things for the benefit of others and society, even if they have some personal cost. This pro-sociality measurement, and we see that April bump again, but then it has leveled off, and so we're not seeing it carrying on declining through June, which I think is really interesting. And so there's a lot of interesting things going on that we're seeing in these surveys. This is a very complicated looking slide. It's quite pretty, but just to give you a sense of the sorts of things that we're seeing internationally. So here what you see is every country in a different colour. So UK is in red here, then we've got the US, Ireland, Germany. And what we did was ask people how much they trusted different sources on a scale of 1 to 7. So from not at all to very much. And so this graph is trying to give a sense of trust. So you have here at this low end, very low trust, and at this end, Ireland, for example, very high trust. And this black line is the mean trust, the average trust. So it just allows us to see at a glance, for instance, this column is politicians, how much you trust the country's politicians to deal effectively with the pandemic. And here you see it's very low in the US and much higher in Ireland. Going on to national scientific and medical advisors, experts not connected with the government, and the WHO. And a couple of things then really strike you when you look at these sort of overall graphs. For instance, Japan here, very low trust in almost everything. And so one of the things that I've been doing is looking at we asked people not just to put a number on their trust, but to tell us why they trust things in this way. And so I wanted to know what was going on in Japan. And these are the sorts of quotes that, that we get from people talking about why they don't trust or do trust information from the government, for example. And you can see, even if we're not asking about the government, they tell us about the government. There's obviously a lot of sentiment in Japan that's very angry, very concerned. And this was a survey done in April, so this was relatively early on for Japan. They felt things were going slowly. And I think these kind of quotes really help us understand what's happening when people are deciding whether to trust something or not. So I'm going to talk briefly now about official information, and particularly about the UK. So we asked people whether they'd come across information from various sources. So this is from people coming across information on posters from the government in different countries. You can see it's very high in Ireland, very low in Japan, middling in the UK. We asked them how much information they'd seen, and we asked them how much they trusted that information. So again, you can see it's very low in Japan. And here in the UK, it changes, it goes down, trust goes down between April and May. But I wanted to look at why people trusted that information the way they did. So in the UK, for instance, I went through all the comments that people had made, and I found that they fell into 4 kind of themes. And the first was a lot of people commented based on the source of the information and the perceived motives of that source of the information. And I've coloured the responses here in green if they were associated with a positive trust score, so above 5, and red if it was associated with a negative trust score. Sorry, go back. And for instance, as Rasmus said, trust in the NHS is very high. So a lot of people were commenting on posters that they'd seen from the NHS, and their trust in the source was high. Trust in the government, some people had high trust, some people had low trust. And a lot of people were commenting on the motives, perceived motives of that source, which I think is very interesting. The next thing people most commonly commented on was consistency of information. Consistency with other information they'd seen, consistency with their own experience, and consistency with their own beliefs. So if things made sense to them, a lot of people said information on posters just made sense, it was common sense, but if it conflicted, then that tended to give it a negative score for them. Not so many people were commenting directly on the quality of the evidence that they were seeing. So some were saying it's backed up by scientific research. They felt that the quality of the evidence behind the statement was there, and but some was commenting that they didn't think it was so scientifically based. They didn't think the quality of the evidence was high. As you see from here, perhaps the virus was so new that they didn't trust we had enough information on it. And then the fourth category, which was much smaller, was people commenting on the level of detail in that information. They trusted it more if it was more complete. If it seemed a bit wishy-washy, if it was incomplete, then they trusted it less. And you can see this for I went through it for every source of information. So again, trust from the government, you can see that they're really commenting on the motives. They believe positive comments about, they believe the government's genuinely caring about the population. But negative, sometimes they didn't trust the information because they perceived that the government were trying to hide information because they didn't want to panic people. And some people overtly said this isn't necessarily a bad thing, but it's why they distrust the information slightly. But again, you can see the 4 categories kind of fall out again. So social media, by contrast, a lot of people commenting on how they don't trust information from social media. But the reasons they give, again, fell into basically those 4 categories, either basically on the source of the information, and again, coming from the motives there, so it seemed well-meaning, was a potential positive, or that it came from trusted friends on social media. But again, it's exactly the same kind of categories. People are looking at the source, the perceived motives of the source, the consistency of the information, and then the quality, the perceived quality of the evidence, whether it was scientific or not. And one thing I wanted to say about social media in the international context was here we noticed that China, people trusted social media a lot more than in other countries where it was all around the same point. So I looked at the comments from China, which I thought were really interesting, because although there were plenty of negative comments that were quite similar to the comments that we saw from Europe and from the Americas, there were some more positive comments that said that they felt that a lot of it was coming from official information, and they felt that social media was regulated. And so I think that's a very interesting comment on the difference between social media in China and the social media in Europe and the Americas, where it is probably from different sources and with different amounts of regulation. There were also a lot of very patriotic comments coming from China, and this is obviously part of the strong messaging that people are getting from the media. And so the final thing that I want to say, and this is a graph, this is not for you to understand what's going on in the graphs because I haven't even labeled them properly, but what I wanted to show was the shape, because trustworthiness, we see again and again, we test messages constantly, and these are all messages about COVID that we've been testing experimentally. This is people's perceived trustworthiness of the 3 messages we were testing, and a different 3 messages we were testing, another 3 messages we were testing. And then we ask people's likelihood of following that piece of advice or tailoring their behaviour to fit the information. You can see the graphs match each other so closely. And we see this much more with trustworthiness than with, say, understanding of advice or understanding of information. People's trust in the information makes a real difference to their likelihood of following the advice or taking notice of the information. So I think studying how people trust information is absolutely key to understanding what people are going to do as a result of that information. So our data, we make it publicly available as quickly as we can. This week's data is not publicly available yet, but it will be soon. And we've written some blogs about it, and those links are there for anybody who wants to go to those. And thank you very much. I will stop there.
Alex, thanks very much indeed. And we've had a host of questions coming in, and I'll try and pick up as many as I can and group them together. There's a very specific one, Rasmus, if I can pick it up first. A number of people have asked, have we any data yet on differences between the UK government nationally and trust in the governments in the devolved nations?
Thank you. Yes, that one stood out. So we only survey people about their trust in and evaluation of the UK government. So we don't ask questions about the devolved nations. There is not one pattern in responses across the different parts of the UK, but it won't surprise anyone when I say that confidence in outside of England is lower in many cases.
So we don't know what Scots think of the Scottish government. We do know that Scots don't think much of the London government.
Hold the front page.
The other point I may bring up is how partisan has been the response, do you find, in British response? Insofar as we know, in the United States, we see a very partisan response to views of how well or badly the pandemic's been.
No, I mean, I think this is a really important one, and it's one of the sort of things that we have discussed in more detail in particular in the most recent fact sheet we published. We published one after each wave. And I think it's an occasion just to sort of surface a question that someone called Rob Street asked in the chat as well, which is about whether there are sort of similar events that can help us understand the dynamics around trust in this particular case of the coronavirus. So, you know, you can imagine sort of coming in different scenarios here. Maybe the decline in trust is driven primarily by people on the left, developing an even dimmer view of a conservative government, or you can have one in which it's a more broad-based decline. And there's really no way, I think, of knowing going in. What we have seen in other contexts, both in the UK and the US, is that trust is often extremely polarized along partisan lines. So when we did a study around the UK general election last year, for example, we saw that people on the left and people on the right came into the election with broadly similar levels of trust in the news media. But after the end of the election, trust amongst people who identify as being on the political right was basically unchanged, and trust amongst people on the left had been greatly diminished in the course of the campaign. So in that case, we had a very one-sided partisan development. In the case of the coronavirus crisis, what we find is that while there are very big differences in terms of the level of trust, people who are on the right trust the government more than people in the center, who in turn trust it more than people on the left, the decline is dramatic across all three groups. And in fact, the decline is more pronounced amongst people in the center and people in the right, perhaps at least in part because they trusted the government more when the crisis started, whereas people on the left had very low trust already and even lower trust at the end. So the trust in this case, in the case of the UK government, is particularly pronounced, a drop amongst people in the political center and people on the political right.
So turning to Alex, there are a number of questions about what do we know about the nature of the trust in science? And is there any distinction, for instance, between the trust in official scientific bodies and in independent scientists? And what happens when the advice given by policymakers and the advice given by scientists appears to diverge, as has certainly happened in the United States, and to a certain extent is happening in the UK? Does your evidence help think about those points?
It doesn't get into the real detail of it, but we did ask about independent experts separately from scientific experts associated with the government. And what we tend to see, and it's not a very strong pattern, and I haven't done the statistics on it, but what I can see from the graphs is that the association with the government tends to mean that they follow that government trajectory more, and the independent scientists tend to follow the science trajectory more. So one is going up in a little April hump, and the other is a slow and steady decline, but we're not with the government associated steep decline that we see. But I would very much like to dig into the particular comments about that. And we haven't got comments. The comments that I've been looking at are from March, and we haven't got free text responses from the later surveys. So I'm hoping to run another survey in the next couple of weeks and put in some specific questions to get at that, because I think you're right, it's really interesting what's happening in the divergence between, well, not some divergence between what we're hearing in the press from scientists and what we're hearing in the press from other researchers and from politicians. And I think it's been a really difficult position for the press to be in, to know how to cover scientific uncertainty during this pandemic and diversity of scientific opinion. And I think we're now seeing a lot more diversity of opinion being covered, and the effect of that, I think, will be really interesting to look into.
Can I just add, Tim, sorry, very quickly on this. I think one of the reasons why it's so important for people to pay attention to the work done by the Wyndham Center and by Alex and the team there is that this, I think, is a critical issue, right? I think there are sort of two big issues here. One is that a lot of the journalists who cover this are general assignment reporters who are used to covering something else, often politics, and understandably don't have the network of sources or the domain expertise to understand quite complex science. And there is a risk sometimes that they fall back on sort of covering this primarily through a source-driven and political lens, rather than the way in which people with more experience of covering science would do it, and people drawing on, for example, the Science Media Center and other important resources in this area. I think the other part of it is the way in which we as members of the public tend to encounter this in the media. Often I think many of us are more accustomed to thinking of sort of what we might call school science, where consensual truths are communicated to us as authoritative. But of course, the reality of the situation in a crisis like COVID is that we're dealing with research science, which is defined by uncertainty. And I think this can be quite hard both for non-specialist journalists, but certainly also for members of the public to sort of recognize that science changing is not a bad thing. It's actually how science works, in particular the frontiers of human knowledge. And if a model is updated, that's not because the first model was bad. It's normally because the second model is slightly less imperfect than the first model. At least that's the idea. And often that scientists disagree is not surprising. It's how, again, this is what they do for a living. So I think there are some sort of folk theories and misconceptions about what research science is actually like that sometimes can influence the coverage in a way that doesn't always do the public a service, but also us, I think, as members of the public, should be mindful that science deals primarily in uncertainty and not in absolute certainties, and certainly not in real-time absolute certainties about a complex and evolving phenomenon like COVID.
This actually picks up another point which a number of people have raised, which relates to the clarity versus complexity issue. It also relates to what Joe's presentation showed, I think, which was everyone thought they understood the rules, but most people disagreed what the rules were. And it's someone has asked, is it clear that people understand the difference between the law, rules, guidelines? And as the government's advice changes, it inevitably becomes more complex. And does that inexorably mean that levels of trust will deteriorate? I suppose, Alex, if I can come to you first. Many countries, of course, are ahead of us in terms of coming out of lockdown. And I wonder if you've got any sense of how trust has altered as the process has gone through, and whether those countries are ahead of us have higher levels now of trust or are coping better than we are.
I don't have enough data on that at the moment, but I think what the complexity versus clarity issue is a really interesting one. And I think there's some of the work that we've been doing is on taking messages of varying levels of complexity. For instance, the WHO tend to have messages followed by a why explanation of, for instance, the 1 meter social distancing rule, which is now being discussed so much in the UK. And so they try to give a scientific explanation. And we tested these two different forms of messaging on the public to see whether adding complexity takes away from trust or whether it actually increases trust because now you're giving more context to it. And we found that adding complexity subjectively people say, oh, more words, it's more difficult to understand. Objectively, they actually understood it perfectly well. And in terms of trust, it absolutely doesn't take away from the trust to give more explanation of why you're giving this piece of advice. And I think this also ties in with the work that you at the Nuffield Foundation helped fund us to do on communicating uncertainty. And adding uncertainty to the way that you are describing your results, again, it didn't undermine people's trust. And so I think there's a lot of fear, and as Rasmus says, it's in journalism, but it's also within the scientific community. There's fear that adding some complexity, and whether that's complexity in terms of detail or if it's complexity in terms of uncertainty, will undermine people's understanding and will undermine people's trust. Well, our research seems to suggest that it doesn't have to. I mean, it can do if you do it unskillfully. But if you are precise and clear, but try to get across complexity and uncertainty, then it doesn't necessarily undermine people's trust. And I think this is something that journalists and researchers need to take into their kind of armory when they're going out and communicating, because a lot of people have this big fear about it.
And aren't I right in thinking your research shows that in Germany, levels of people who think they understood are higher than elsewhere?
You know my research better than I do.
I thought it was quite interesting that it seemed to me that the clarity of messaging from Germany had been particularly effective.
You're right. So the clarity of the message from the government. So when we asked people if they understood the government's plan, then Germany, it was higher at that point in the pandemic for them. And I think the point that we were comparing it with in the UK was late March in the UK, so pre-lockdown, when I think there was a lot of confusion. There had been none of the governmental national broadcasts. There was a lot more confusion about messaging. And then that April hump that we saw in trust, there was a clarity of message, there was a higher understanding of message. But as I said, understanding levels, subjective understanding levels and trust levels are not necessarily linked to each other. So people can say that they don't understand it quite so well, but they still trust it equally well.
And I wonder if both of you finally, because I think we've got room for one final area of questioning, relating to that fascinating piece of research you had, Rasmus, that people really don't have any firm views one way or the other about the role of platforms, and yet clearly there are very strong views about, in different directions, about the use of social media. And this entire pandemic has been driven by digital communications. There seems to be a paradox there. Rasmus, how would you reflect on the difference there between people don't really feel strongly about the platforms, but they certainly feel strongly about how the platforms are operating?
I mean, I suppose that much of our research suggests that while there is an increasingly, active and important elite discussion amongst policymakers, intellectuals, and activists about the exact operations, social implications, and differences between different large for-profit platform companies and what it means for them to exist in the world and influence our societies, I suppose that we often find in our research that the majority of the public doesn't think so much about these issues, and when thinking about it, would approach it sort of primarily in two ways. One is to effectively treat these large for-profit companies as sort of pretty naturalized parts of the things that they take for granted in their daily life, not so different from utilities companies. You flip a switch, you don't think too much about where it comes from and why and how it works and who's behind it and who makes money and so on and so forth. You just do it because it enables you to do things that are important for you and that you value and that you enjoy. And we see a lot of that around the use of digital platforms as well. That one, I think some could sort of worry about, is that sort of too complacent. And I think there is an important discussion there about literacy, if you will. I would say that there is another side of this, which is that we find that the majority of the public in most of the countries we do our research and approach information and news on the platforms with what we call generalized skepticism. People are not naive fools who believe everything they see some stranger post on Nextdoor or share on Facebook or on WhatsApp. No, absolutely not. If anything, we might have almost the opposite problem, that people are incredibly cynical and skeptical of almost everything they see. And as we have shown, that applies to news organizations, the government too. So we find in general that people are extremely skeptical of much of the information they come across online, including on platforms. And that may help account for why, even though there demonstrably are very real misinformation problems, that we haven't found any significant and systematic evidence that people who rely on these services are in fact misinformed, even though the misinformation, of course, is very real. So if people are skeptical enough, perhaps we can then move on to try to address whatever complacency may exist and help people better understand so they can make their own decisions about what they think about these companies and how they want to use them and what they think of their role in our societies.
Thanks, Rasmus. And finally, we're just about out of time, but Alex, can I ask you a general question? As you look at that survey across all those different countries, are there any things that particularly worry you, things you think we should be worried about as you take stock of it as a whole?
My big worry was seeing the decline in trust in science and scientific information, because it may not be the precipitous decline that you see in trust in official and government sources, but I think anything that's eroding trust in scientific information is a concern, because scientific information, particularly around COVID, is increasing. We're knowing more about it. We should not be seeing a decline in that trust. And I think that's got to be to do with communication. So I think we should be thinking very hard as a scientific community about how we're doing that communication and why the public are losing trust in us.
It seems to me that that answer actually answers the last question we've just had in, which is, if there was one learning you would suggest government picked up, it would be that, I take it. Yeah. Yes. And Rasmus, any final thought from you in terms of what's worrying you most?
I mean, I suppose that I tend to think that healthy skepticism is in fact healthy. And if people have reality-based reservations about whether some institutions are in fact responding well to the crisis, that is a sign of a healthy public and an informed public. I'm also encouraged by the fact that most of our research suggests that most people are quite pro-social and quite compliant and quite sort of cautious and thoughtful in their response to the crisis and know relatively quite a lot about the disease. In that sense, I think many of our findings are encouraging in some ways. I think there is a very real issue that Alex's important work has illustrated, which is about where do we go from here as things become more complicated and we start from this phase of very low trust and very low confidence in the government in particular. And also as the messaging grows, I think a little bit more ambiguous, if you will. Perhaps it's time for a clarification of what exactly stay alert means. And if I can be cute, I might suggest that the clarification should perhaps be a bit more precise than just saying that alert means alert.
Well, thank you both very much, and thank you to everyone who's been participating in this webinar. I hope we've answered as many of your questions as you hoped we would. There are other questions there, and we'll make sure we get back to you on them. But thanks very much, everyone, for joining us. There'll be other Nuffield Foundation seminars on our research on COVID, and we'll be back soon. But thanks very much for coming, and take care.
Thank you.